This is Mary Ann Wooten. Before we get started, do you give your consent to have your head-to-toe nursing assessment performed, videoed, uploaded to YouTube, and viewed by Pensacola State College instructor?
Yes.
Thank you. This is Mary Ann Wooten with the head-to-toe nursing assessment. When I first walked in, I introduced myself to my patient and I performed hand hygiene. We established that the reason that he was here was just for his annual physical exam. I got his health history. He has no significant health history other than a history of hypertension, for which he takes medication, atenolol, 50 milligrams per day. Also went ahead and did a general survey. He looked sustained at age. He had a normal level of consciousness. His skin was clear, no lesions. He seemed to have good nutritional status. Watching him walk around, he seemed to have good posture, good range of motion, no use of assistive devices. His expression and mood were all normal for the situation. He had clear speech and seemed to have good hearing. He had good hygiene. We went ahead and tested his vision using the Snellen eye chart, and it was normal 20/20 vision. Also went ahead and took his vital signs. All of his vital signs were within normal limits. The only exception was his weight was a little elevated. We started the assessment by doing a skin assessment on his hands and nails. For the rest of the skin assessment, we'll incorporate that into the rest of the head-to-toe assessment. So we've already completed that. I'm back in the room, and now I'm just inspecting the head and the face. Again, I'm looking for any skin lesions, anything abnormal. So now I'm just going to palpate. Palpating your temporal artery. I'm going to palpate your temporomandibular joint. You can open and close your mouth. Any pain with that?
No.
Now I'm going to just touch your sinuses and you tell me if you feel any pain. Any pain?
No.
Any pain?
No.
Okay. So we're going to start with your eyes, and I want you to cover one eye, and you tell me when you see my fingers.
No.
Other side? I'm going to check your eyes for the corneal light reflex. Very good. Now follow my pen as I move it into different positions. Now look at my pen. Look past me to the wall. Look at my pen. And pass me to the wall. Checking for accommodation. Now I'm just going to look at your external eye. Eyebrows are even. Everything looks normal. I'm going to pull the lower lid down. Check your conjunctiva, irises, sclera. Very good. Now I would darken the room and I would check his pupils. Very good. I would darken the room even more, and I would use an ophthalmoscope to check for the red reflex. While I was looking into the eye, I would also look at the background, I would look for the disc, and I would check the vessels. We don't have an ophthalmoscope, so we're just going to simulate that. Since we simulated it, we're just going to say that everything was normal. We're going to move on to your ears. Any pain?
No.
Again, I'm checking the skin as I go. Now I'm going to look inside your ears. Checking the ear canal and the tympanic membrane. Ear canals look fine, no swelling. Tympanic membranes were intact and all the landmarks were present. Now we're going to test your hearing. I'd like for you to put one finger on your ear. We're going to do a whisper test. I'd like for you to move it slightly to block the hearing in that ear. I'm going to whisper a word and you repeat it.
School. Bus. Tuesday.
Good, let's go to the other side.
Cat. Dream. House.
Very good. At this time, we would use a tuning fork to do the vapor test. We don't have one, so we're going to simulate that. What I would do is strike the tuning fork so that it would vibrate, and the patient would tell me when he heard that vibration.
Now.
We would then do a Renna test with the tuning fork. I would strike it, I would place it on this bone, and you would tell me when you heard that.
Now.
We would be testing for bone conduction. We would do the same thing, striking it and testing for air conduction.
Now.
We'll do it on the other side. I would strike the fork, place it on the bone.
Now.
I would strike it again and place it near the ear.
Now.
Very good. Now I'm going to check your nose. First, I'm checking the skin, I'm looking for symmetry, seeing if there's any flaring, any discharge. Everything looks normal. Check for patency. And other side. Very good. I'm going to look inside the nose. I would use a nasal attachment for the otoscope. We don't have a nasal attachment. We're just going to simulate that. Since we're only able to simulate it, we're going to say that everything was normal. Now I'm going to look inside your mouth. Open up. Checking all the buccal mucosa. Under your tongue. And back down. Lift up, say ah. Uvula lifts. Seeing the tonsils. I'm going to check for your gag reflex. Okay. And can you stick your tongue out? Very good. Now we're going to move on to the neck. First, I'm just going to look again, looking for any pulsations, just assessing it. Now I'm going to check your carotid pulse, one side at a time. Now I'm going to palpate for lymph nodes. You tell me if you feel any tenderness. Shoulders lightly. Very good. Make sure your trachea is midline. Okay. So if you put your head back and down and back up. Now side to side. Shrug your shoulders. Let's do the same thing with resistance. And shrug your shoulders. Now I'm going to hand you a cup of water. I'm just going to fill your throat as you swallow the water. Ready? One more time. Very good, thank you. Go pivot around. Normally I would move around my patient. I wouldn't have my patient move. We're only moving this time for the camera. Again, we're incorporating the skin assessment as we go. So I'm checking the skin. I'm also looking for symmetry, the shape, checking for respirations. We're going to check for symmetric excursion. Breathe in and out. And again. Now I'm just gonna lightly palpate. Lean your head forward, please. Checking the spinous processes. Now I'm going to see if there's any tenderness at the costovertebral angles. Tell me if this hurts, please.
No.
Good. Very good. Now I'm just going to percuss. Okay, lean forward slightly. Now we're going to find a pin out. We're going to mark the borders of your lungs. I'd like for you to inhale or exhale and hold it. And exhale and hold it. Now breathe normally. Same thing on the other side. Exhale and hold it. Okay, breathe normally. And now inhale and hold it. I'm just going to take a measurement. Now I'm going to listen. You to pivot back around. Again, normally I wouldn't move my patient. We're only moving this time for the camera. Pull it down. Incorporating the skin assessment. I'll be checking for the skin. I'll be looking for symmetry and also checking for respirations. Okay. Now I'm going to check for tactile firmitas. If you can repeat the phrase 99.
99, 99, 99, 99, 99.
Very good. Now I'm just going to palpate. Very good. Now I'm going to percuss. And now I'm going to take a listen. Breathe in and out. Again. Get you to lean forward and listen at the base of the heart. Very good. All right. As I stated previously, we've already done the skin assessment on the hands and the nails. I'll be incorporating the skin assessment into the arms, the range of motion. Let's go ahead and check your range of motion. Put your arms out for me. Move your hands. Move your arms out and in, and back down, and up, all the way up, and back down. Okay. Also, I've already checked your pulse, but I'm just going to check again for symmetry. And now I'm going to see if I can feel any lymph nodes. And I'm going to check lymph nodes in your axilla. Very good. And again, I'm going to check your axilla. Very good. And get you to lean back. Normally we would have the head of the bed at 30 degrees. We were going to be checking the neck. I would be looking for any pulsations, any distension. I don't see any. We could also estimate a pressure at this point. We're going to move on to the heart. First, I'm just going to feel through apical pulse. I'm just feeling over the precordium. And now I'm going to take a listen. First, I'm going to use the diaphragm of my stethoscope, and I'm going to be listening for the S1 and the S2 and seeing if there's an S3 or S4 present. S1 and S2 are crisp. No, S3, S4. Now I'm going to do the same thing. I'm going to listen with the veil of my stethoscope, and I'm going to be listening for murmurs. No murmurs heard. You can just roll to your left. Just feeling again for that apical impulse. And now I'm going to listen again. Okay, roll back over. At this time, I would lower the bed to flat, and we're just going to expose your abdomen. Again, I would use the light to shine over the abdomen. I'm also incorporating the skin assessment. I'm going to be looking at the contour of the abdomen. I'm going to be looking for any pulsations, any unusual lumps. So now I'm just going to listen. I'm going to use my stethoscope. I'm going to listen in all four quadrants for bowel sounds, and then I'm going to listen again for vascular sounds. Vowel sounds are normal. I can hear them in all four quadrants. We're going to listen again for vascular sounds. other sounds I heard. Now I'm just going to percuss over your abdomen. Cussing over the spleen. And now we're going to find the border of your liver. And now we're going to find the lower border. We're just percussing upward in the midclavicular line. Very good. Now I'm going to lightly palpate. Tell me if you feel any pain. Now I'm going to palpate more deeply. Now I'm going to try to palpate the lower border of your liver. I'm going to try to palpate your spleen. Should not be palpable. I'm also going to try to palpate your right kidney. And your aorta pulsation. Moving on to the legs. First, I'm just looking and inspecting, and again, I'm incorporating the skin assessment. So I'm checking the skin for any lesions. I'm checking the skin for uniformity, hair distribution. Also checking for symmetry, for length. And now I'm going to check your pulses. Checking your pulses on this side. Now I'm just going to feel with the back of my hands, feeling for your skin temperature. It's warm and dry. Now I'm just palpating, checking for edema. And I'm going to check between the toes. Now let's check for range of motion. I'd like for you to bring your leg straight up, please. And now your knee. Same with the other leg. And your knee. Can you do the same with both of your ankles? with your toes. Very good. Now I would like for you to place this heel on this shin and rub it up and down. Very good. Other side. Very good. Now I'm going to sit you up. Watching for muscle strength as you sit up. Now we're going to move on to the neuro exam. I'm going to see if you can differentiate between sharp and dull. This is sharp. This is dull. Okay? With your eyes closed, you tell me if it's sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Okay. We would also use a tuning fork to test a sense of vibration. And we would put that on his toe and we would let it vibrate and see if he could sense that. Now I'm going to use a wisp of cotton, and with your eyes closed, I would just like for you to tell me when the cotton touches you. Very good. You can open your eyes. Give me your hand and we're going to check your sense of position. I'm going to move your finger either up or down with your eyes closed and you tell me which.
Down, up, down,
Very good. Let's try the other hand.
down, up.
Very good. Eyes open. All right, now repeat what I do. Do that as fast as you can. Faster, faster, faster. Very good. Put your finger on your nose, please. I want you to touch your nose to my finger. Other side. Very good. I'm going to place an object in your hand with your eyes closed. I'd like for you to try to tell me what the object is.
Pen.
Very good. Now we're going to check for your reflexes. Normally we would use a reflex hammer. We don't have one, so we're going to simulate that. Since we're only simulating it, we may not get a reflex, but we're just going to say that they're normal reflexes. We did get a reflex. Doing the Achilles, and then checking for the Babinski reflex. Made you jump. Okay, if you'll stand up, please. I'd like for you just to walk to that wall. Stand there for just a moment. Let me check your legs. Checking again for the skin, also checking for any varicose veins. Okay, you'll walk to the wall. back around walking heel to toe. Okay. Now let me get you to take a few steps back toward the wall on your tiptoes and then a few on your heels. Very good. You'll stand by the bed. I'm going to get you to close your eyes and just stand still for just a moment. Very good. Open your eyes. If you lean forward, I'm going to check your spine. Are you able to touch your toes? And back up. While I'm stabilizing you at the waist, lean back and straight up. And rotate side to side. And now lean side to side. Very good. Have a seat. At this time, I would inform my patient that I'm going to leave the room for a moment and let him get redressed. When I come back in the room, we would discuss the findings of his nursing assessment, and we would also discuss any needed health promotion activities. Thank you for watching.